We will be discussing the newborn cardiovascular assessment. So what would be the critical importance in doing this cardiovascular assessment? Of course, it categorizes the severity of patient illness, and it also recognizes shock and congenital or new heart disease. So our goal for this cardiovascular assessment is of course the first thing that we need to do is of course to do the general assessment or to check for the appearance of the newborn. Then another thing it would be is the checking of the vital signs, and the third one would be the physical assessment or the thorough cardiovascular assessment. So let's discuss this one by one. So in general appearance, of course, you need to check the color. You need to check for the color of the newborn. Are they pale, pink, mottled, or blue? So the normal would be the pink. And do they look like they are awake, alert, or calm? So you need to observe. Then, are they agitated or lethargic? And do they appear malnourished or well-nourished? So how are you going to check for the nourishment of the newborn? Of course, you'll be checking, of course, for the height and weight of the newborn. And if the child is visiting her pediatrician, the mother have this logbook wherein there is a graphical representation of his weight and height, which indicate, of course, the nourishment of the child. So in doing the general assessment, of course, you need again to check for the color, if it's pale, pink, or mottled, and of course if it's blue. And check for the alertness. Is she awake, calm, or comfortable, agitated and lethargic, and again for the nutritional status. Then, you need to check as well the vital signs. So, the first vital signs that you will be checking is for the heart rate. So, you need to listen to the heart rate and start counting where? Of course, here in the apical side of the newborn. So, you need to check for the heart rate of the newborn. And you can also do counter-checking by checking his radial pulse. Then know the normal ranges, of course, depending on age. Then identify whether there is a slow rate. So when we say there is a slow rate, it's an indication of bradycardia. And fast heart rate is tachycardia. And the normal heart rate is, of course, normal sinus rhythm. So here is the visual presentation on how are you going to check for the newborn's heart rate. Okay, then aside from the heart rate, you will also be checking for the blood pressure of the newborn, because this will give information related to cardiac output of the patient. And this blood pressure comprises of the three different numbers. The first one, of course, is the systolic blood pressure, wherein it measures pressure during the pumping phase of the heart rate. And the diastolic pressure, it measures the pressure in the patient's vasculature during refilling portion of the heart pumping. So how are you going to identify the systolic and of course the diastolic? So the first sound that you will be hearing while inflating the bulb of the blood pressure is of course what we call the systolic pressure. And the last sound that you will be hearing is what we call the diastolic pressure. And the last one would be the mean arterial pressure, wherein this one is an average using special calculation of pressure throughout the cycle of pumping of the heart. So what would be the formula for MAP? So we have the systolic BP plus 2 times the diastolic BP, then divisible by 3. So assuming that the patient is having the blood pressure of 90/60, so 90 is considered systolic, plus 2, which times 60 is the diastolic BP, then you divide it by 3. That's the time that you can get the mean arterial pressure of the patient. So as you can see from the visual presentation, so specifically, if you're getting the blood pressure of the newborn, you need to do what? You need to check for the size and cuff. and the placement of the cuff. Okay, so you need to obtain BP on each extremity, or what we call the 4-point BP. So when we say 4-point BP, you'll be checking for the left and right upper extremity BP, and of course the lower extremity, the left and right lower extremity BP. So the bigger cuff will give you falsely low BP, and the smaller cuff will give you falsely high BP. So what are you going to do? You need to check, you need to use for the right size of the BP cuff for the newborn. Okay, so in some patients, like of course the adult patients, so same thing will apply. So you need to use the right size for the right age of your patient. Then the normal BP ranges, this one is from the pediatric life support system. So for the neonates, we have 0 to 28 days. So the systolic should be greater than 60 millimeter of mercury. And for infants 1 to 12 months, the systolic BP should be greater than 70. And for age 1 to 10, you need to calculate the lowest threshold for systolic BP. So the constant would be 70, plus assuming that the age of the child is 5 years old, you need to multiply that one by 2. So 5 times 2 is 10, then added to the constant number, which is the 70, you will be getting the 80 millimeter of mercury as his considered as his normal systolic pressure. And for age greater than 10 years old, the systolic pressure should be greater than 90 millimeter of mercury. So what do we mean by this? If there should be below this given numerical values, or there is a hypotension, this one is a very late sign in shock. So anything below the given systolic pressure is considered hypotensive that needs to be reported to the team. So why do we need to check for the systolic pressure of the newborn? Because we want to prevent shock for the newborn. Okay? So in doing the cardiovascular assessment, which is the last one, we need to do the physical exam by following this step. We need to look, to feel, and of course to listen. So let's take first the look. You need to look for any signs or symptoms of diminished cardiac output or poor cardiac function. So look for the color again, and perfusion if the child is pink. So meaning if the child is pink, she is well perfused, but if the child is pale, it indicates anemic or poor cardiac output, or some clamping down or narrowing of the blood vessels in response to shock. Then what else? Look for presence of clubbing. Look for at the fingertips. Okay, expansion of fingernail or fingertips caused by the prolonged and long term of hypoxemia. So you need to check for the toenails, the fingertips, and even the toenails. So you need to check for the clubbing. So typically this one is seen in children with congenital heart defects. Then what else? Look for edema or swelling. So in some, they have this kind of generalized edema all throughout his body. So a patient as a whole looks a little bit puffy and fluid overload. As you will observe from his body, there is little bit puffiness of the skin. Okay, even the face of the patient, the newborn, is also puffy. And try to also look for the lower extremity, because sometimes there is a lower extremity edema. This one is often associated also with the congestive heart failure. And you need to check for the pitting edema. So how are you going to check for the pitting edema? So you will just indent. Indentation that may remain for some time, and that one should be graded from 0 to 4. Okay? So you will be checking if there is a presence of pitting edema. So as you can see from the visual representation of generalized edema, and of course the pitting edema. Then look also for any visible pulsations. Look for jugular vein distension, because this indicates some sort of blockage, obstruction or heart problem. So how are you going to check for the jugular vein? Of course, you need to position your baby like this one. You need to check for the neck part. Okay? So, let me use the other doll. So, you need to check for this side. So, if you will be checking the jugular vein, if you will be checking the jugular vein from this side, so you need to expose this side. But if you will be checking the jugular vein here, so you need to expose this side. So you need to check for this one. Okay, if there is an pulsation there, so this one is an indication of some problem also. So in some baby, it's normal if you will see the jugular vein, but you need to check if there is pulsation or bounding pulsation in that kind of jugular vein. Okay, if there is a distended jugular vein there, so you need to report that one also to your pediatrician. And you need to look at their chest if there is a precordium move up and down. But anyway, that one is also normal. But you need to check as well if how is the baby, is if she's having a heartbeat like this one, the moving up and down of the precordium. You need to check if she's having a difficulty of breathing as well, and you need to check for the moving of his heart. Okay, if it's too fast, and if you think that it's abnormal, you need to report that one also to the attending physician or the emergency team. So that's it. That's the visual representation of the jugular vein distension. Then another thing is to feel or touch. So we're now in the feeling or touch, because beforehand we have this looking for the or assessing for the child. So from this time we'll be doing the touching and feeling of the newborn. So you need to check for the brachial artery. So this one is, here is the brachial artery, which is the upper more medial part of the arm. So, and another thing is you need to palpate as well for the femoral pulse, wherein that one is being seen or being palpated on the groin. And for older children, you may feel the carotid pulse, which is located on the side neck. So here is the carotid. Okay, so here is the carotid pulse. So you need to feel the carotid pulse. So meaning this brachial artery, the femoral pulse, and of course the carotid pulse is what we called as the central pulses. So absence of these central pulses indicates the need for immediate CPR, and you need to call for the emergency response. Again, the central pulses are the brachial artery, the femoral artery, and of course the carotid artery. Then you need to feel also for the child's peripheral pulses. So palpate for the radial artery. So how are you going to feel for the radial artery? Okay, you need to use for the 2 fingertips. Okay, by checking the radial artery. So it is advisable that you need to check both for the upper extremity of his radial pulses. Then feel also the dorsalis pedis and the posterior tibial pulses. Note whether it's strong, normal, weak, or threading, and graded on 0 to +4 basis. So 0 means absence of pulses, and 1 to 2 is the normal, and 3 to 4, which is bounding, is considered an indication sort of hyperdynamic state in the patient, which indicates something called warm shock. So again, the peripheral pulses are the radial artery, the dorsalis pedis, and the posterior tibial pulses. So these are the peripheral pulses. So you need to feel the overall temperature of the patient, okay? You need to touch. Do they feel hot, cold, or warm? So warm and dry is normal. Then, but cool and clammy indicates that there is something wrong with the vasculature and warrants further investigations. You may also feel the trunk and of course the abdomen as well. So cold hands and feet. So you need to feel also the hands and the feet of the patient, because it indicates the beginning of shock. If you feel that there is cold clamminess of this area, then you need to check also for the capillary refill time, or the CRT. So how are you going to check for the CRT for the newborn? In adult patient, we're pressing the nail bed, okay, the nail bed of the adult patient. So same thing, the normal is in less than 2 seconds. The blanch should return to normal in less than 2 seconds. But if it returned to 3 to 4 seconds, there is already a delay in the CRT. And if it's more than 5 seconds, it indicates serious problem and most likely requires immediate intervention. So for newborn, so what are we going to do to check for the CRT? So we will just press, okay? We will just put pressure on his hands, and you will see the white or blanch there. Then you will observe that one. If that one will, if the spontaneous return will return in less than 2 seconds. Okay? So that is the way of checking the capillary refill time for the newborn. Then the last one would be listen to the basic heart sounds with the use, of course, with the stethoscope. So you'll be hearing the lab dub. So for S1 is the closing of the AV valve. For S2 is the closing of the semilunar valves. And for the S3, which is the galloping sound and usually heard at the apex of the heart, that one is also abnormal. And S4 is concerning low frequency sound, which indicates hypertension and cardiomyopathy. So listening to the patient chest, and you need to count the heart rate, then identify abnormalities, if any, then refer for immediate action. Anyway, checking for this heart is also need to be rechecked as well by the attending physician or the expert when it comes, if they suspected that this baby or the newborn is having this cardiac problem. But at least as nurses, we need also to do some sort of examination that will also an additional findings, or that will help also in the determining problems with the newborn. Okay, so listening to the pericardial friction rub also is one of the things that you need to also to check. So how are you going to check for the pericardial friction rub? So it's like rubbing a piece of hair in between two fingers. So the sounds that that is being produced in doing that will indicate that there is a pericardial fusion or could develop pericardiotomy. Then listen for any murmurs. So abnormal connection between heart chambers, and there is an abnormal valve function. So don't be get nervous if you will be doing the checking of the heart sounds. That one is additional knowledge for you actually, because that one, checking of the heart sound, should also be doing or will be re-examined by the attending physician and even the cardiology of the patient. So what are the causes of concern? So what is our focus as nurses in checking for the cardiovascular system of the child? You need to determine if there is a tachycardia or high heart rate, because this one is the first indicator the child is becoming more ill. Then decreased perfusion, again, check for the poor color, pale white spot developing around the patient's body. Then decreased capillary time, again, the normal should be less than 2 seconds. And check if the baby is lethargic or sleepy. Then if it's becoming unresponsive to pain, the patient should be evaluated immediately. If the patient is becoming flaccid and there is a low tone, and especially if you have checked that her BP is very low, which is hypotensive, and the same thing, bradycardia, that's also a cause of concern. And another thing, the last one would also you need to do is to check also for the output of the patient. You need to check for the urine output due to compromised cardiac output of the newborn. So how are you going to check for the urine output? You need to check for the diaper of the child, and you need to also ask the mother how frequent the baby is urinating. And one thing is, you need to, of course, to weigh the diaper of the child every actually, if it's the doctor has asked you to check it every 2 hours or every 4 hours, you need to check the you weigh the diaper of the child for you to have the accurate output with regards to the urine output of the newborn. So that's it for today. So please be informed that you'll be doing your return demonstration for this cardiovascular assessment of the newborn. So I will be sending you the video, which is we will set as your guide in doing your own return demonstration for this cardiovascular assessment. So let me remind you, you need to use our PowerPoint presentation or the different topics that we've discussed in this PowerPoint presentation that will be in that needs to be applied on your return demonstration. Okay, so thank you very much and hope to see you by next week.